About 59% of Virginians are fully vaccinated, some more than 66% with at least one dose, but that means 33% haven't gotten a single shot.
CBS 6 wanted to find out why some people are choosing not to be vaccinated and what health leaders plan to do to increase immunity if the unvaccinated don't change their minds. Our Caroline Colburn spent the day talking with people and picks up our coverage. Caroline?
Well, Cheryl, I've heard everything from infertility fears to potential long-term side effects of the vaccine. But everyone I spoke to today felt fearful of speaking on camera because they didn't want to be judged based on their decision. And that's something health leaders say is a problem.
Why ain't you vaccinated?
I'm not completely against vaccines.
Landon Johnson is one of many Virginians hesitant to get a COVID-19 vaccine.
Yeah, we haven't had enough time to really see what it's really going to do.
The young Richmonder shared his perspective during this roundtable at Village of Faith Church last month, hosted by pastor and Richmond City Councilor Mike Jones.
The whole rationale was vaccination hesitancy within the African American church. We're being impacted by it. We're dying from it. We're being hospitalized by it. And so what can we do to arm ourselves?
The city leader is working to arm his community with knowledge by bringing in local experts like Dr. Robert Wynn to dispel vaccine rumors and misinformation.
So let's not act like this tool just came up. This tool was there, made for something else, and it just happened to be on the shelf. And we were able to say, all right, let's take it from the shelf, tweak it, boom, and get it ready. So I think that we have to tell the complete story.
Finding local doctors and faith leaders to inform communities about the vaccine is a strategy state health leaders believe is key to increasing immunity.
People have lost trust in the government, and so they don't know when a CDC makes a recommendation. They don't know if they can believe it or not.
Virginia vaccine coordinator Dr. Danny Avula says the biggest reason people aren't getting a shot is fear of long-term side effects. So what if those people don't change their minds? How do we fight the virus then?
At some point, we will have enough of the population who is either fully vaccinated and therefore protected against severe disease, or who have been infected by COVID and have some degree of natural immunity.
But Dr. Avula would rather see more people vaccinated and fewer Virginians ending up in the hospital on ventilators or dying from the disease. So instead of blaming or shaming those who aren't vaccinated,
we need to continually be non-judgmental. We need to listen well. We need to understand why it is that people have hesitations about this. And we need to continually bring good information, credible information in front of people and help them work to that decision.
Now, for those who are worried about potential long-term side effects of the vaccine, Dr. Avula notes that most side effects show up within the first few months of a vaccine rollout. And while the COVID-19 vaccine is new, he says similar vaccines have been studied for the last 2 decades. So he wants to remind Virginians the best thing to do to get in line to get a vaccine.